Hi, everyone, and thank you for joining us for Forward DFW together with the Dallas Morning News. I'm Ron Corning, and Baylor Scott and White Health has always been a leader in healthcare in Texas, setting an example for healthcare across the country, really. So it may come as no surprise that their work to innovate with a new healthcare app has really caught on and will likely, again, set an example for other healthcare systems around the country. It is called MyBSWHealth app, and we are joined by Dr. Tiffany Berry. She's the Vice President of Primary Care. It's good to see you, Dr. Berry. Thank you for joining us.
Hi, my pleasure. Thank you.
2 million active and engaged users since this healthcare app launched just before the pandemic. So interestingly enough, you were in a position when the pandemic hit to be able to really visit with patients who you couldn't visit with in person. But by the numbers, how does that sit with you? 2 million active users. That's pretty extraordinary.
It makes me so proud. I don't know what we'd have done as Texans, as a community, but as a healthcare system, if we hadn't had a highly functioning app and virtual services when the pandemic hit. You know, before the pandemic, healthcare is not that quick to move. It was tough to get our doctors to adopt virtual care, and it was tough to get our patients to adopt it as well. But we all had to learn the new normal during the pandemic, learn to use virtual services and apps more readily. And that applied to us too. So very excited that we had this up and going and that we were able to continue to provide good care to patients in our communities with it.
So you saw people basically rise up and meet the challenge when they had to out of necessity because of the pandemic on both sides, be it healthcare professionals, the doctors, right? And the patients as well. And now they really have you seen them really embrace it moving forward as a matter of convenience and as a matter of accessibility when otherwise some patients may not engage with the doctor as often?
Yes, absolutely. So there's a couple great things. One, the virtual services that the app allows. Once you do it, it's really hard to want to go in person unless you absolutely have to, because I can do it from the convenience of my home, for myself, with my kids, with my parents. And then I call it the command center of my family's health, because it's the one-stop shop. I have access to my kids and my parents and my own healthcare and can view test results, communicate with my provider, my physician's office, et cetera. So it's just a great win all the way around.
I want to talk about the number of ways in which this healthcare app is innovative, not just the technology, but working outside of convention. No subscription cost to download the app and have access to a range of information. That makes accessibility to healthcare information that's accurate better for people rather than them searching the web and finding some page that's not really endorsed by a medical professional. But secondly, you don't have to be a member of the Baylor Scott and White healthcare system in order to access a doctor for an e-visit. What are you seeing there in terms of people who maybe live in rural communities where they don't have access to a large hospital system?
It's just great. So e-visits are our quick, we call them asynchronous visits, where you just fill out basically a questionnaire, a very simple health issues. So things like a urinary tract infection, if you've had them before, or a swimmer's ear. At 3 a.m., my child developed a pain ache in his ear. We'd been swimming, knew what it was. And so I was able to fill out a quick form. And that morning I had a prescription ready for me at the pharmacy. So it was amazing. Even for me as a person that has access to healthcare, obviously, but in our rural communities, I mean, it's quite a drive, assuming you even have a way to get to the doctor sometimes. Mm-hmm. So I think it is a fabulous option for simple health issues, e-visits. It's a $40 flat fee. And if it's not covered by your insurance. So just a super convenient way to get easy access. And then the video visits are available 24/7 for the more somewhat complex issues. So I need to talk this through with my provider. Maybe I don't know exactly what's going on. I need to show you this rash, or I need to show you a bump or something like that, that maybe I need access to a camera to do. Another great option for to keep you out of ER or in urgent care, or even at home in your own bed, and get help.
Let's talk about the benefits of that. So first of all, you've made this accessible with a $40 flat fee to the uninsured. So people who who may otherwise never have a conversation with a doctor about a relatively minor health issue that could get worse, they have an opportunity to talk to a doctor to get ahead of a crisis that could be a lot worse. So there's that for the uninsured. Then it sounds like it accelerates depending on the need. The video visit comes next, and then you assess if that person does need to visit an actual physician. But you make a point here about not going to the ER. If people are able to take care of certain healthcare issues via this app, then they're not crowding ERs, right, where they could be exposed to other illness and so forth, and also tax the system in person. In other words, the healthcare professionals aren't dealing with a range of issues that could be solved online.
Yes, and certainly to the consumer of the healthcare, the patient, an ER visit is significantly more expensive and, of course, very inconvenient. I mean, ERs are great when you truly have an emergency, but for the just what I call an unplanned health issue, I just have a thing that came up that I wasn't expecting and I don't have a doctor's appointment available readily for me or don't feel like trying to make one. This is just an exceptional option. The e-visits are $40 for all. I'm so proud that we're able to offer that. And Texas has problems and issues, challenges with uninsured populations or even insured, but they have high deductibles. Mm-hmm. And so offering that for $40 is just a great option for, again, simple issues.
This app was established and available before the pandemic. The pandemic comes along and people, as we said, out of necessity begin to use it, feel more comfortable with it. And then in August of last year, you launched the 24/7 accessibility for even childcare. I'm thinking about that parent. This just changes the way in which healthcare is delivered to the benefit of everybody.
It does. The cost and inconvenience of healthcare, period, let's be honest, it is a drain on everyone. Healthcare is hard. Nobody wants to go to the doctor, and you sure as heck don't have time to go to the doctor. I'm in that sandwich generation where I'm helping my parents and I'm still taking care of kids and trying to take care of myself. And that combination is taxing, to say the least.
You also, Dr. Berry, are one of the first in the nation to offer vaccinations with in-home visits.
Yes. So in-home vaccinations, again, our goal just being how convenient can we make good healthcare? And so I get a lot of things sent to my home these days, Amazon, groceries, et cetera. So how can we actually give good, reliable healthcare in the home? One of our first steps into that has been immunizations. Folks got behind on immunizations and routine healthcare needs during the pandemic because we all had a lot going on. And so trying to catch back up on those things and, again, make it more convenient. Not just COVID vaccines, of course, just routine immunizations that we all need.
Well, I'm looking at the list and you've got every age range covered, right? From childhood vaccination. So if you've got small children, the old idea of loading them up, getting them ready for a doctor's visit, which can be anxiety inducing for a child. Instead, you can have that visit right at home. Convenient, not as unsettling for a child, but also I'm thinking about seniors who may not have access for various reasons, whether it be transportation, immobility. You come to them for some of those important vaccinations that apply to the over 50.
Yes. So our goal is not to take the place of seeing your doctor, but especially for our older folks who already have a lot of doctor's visits, it's just one more thing I have to go to the doctor for. And most clinics don't have all vaccines right there in stock. So it's a trip to a pharmacy or something else. And again, that just becomes a drain.
And Dr. Berry, I'm thinking that when you all make a visit to a home, everybody can be covered, right? Parents, children, multi-generational families. If there's an elderly person in the home, everybody can sort of get on the vaccination bandwagon?
Yes, it's actually really cool because things like a new baby being welcomed into the family, folks are due for their pertussis vaccinations. And so you can get the whole multi-generational family together and celebrate and protect mom and baby. Same for flu shots. Once a year, gather everybody up and let's just knock it all out together. So I think that's a really cool bonding time and super convenient.
There's another part of this too, which I think is so important, and you're calling it community support. It's a forum that you can access with the app that like the app itself, or like the medical component of the app itself is really, really resonating with people. And we're going to talk about that as well, Dr. Berry, when we come back with the Chief Mission and Ministry Officer for Baylor Scott and White Health. Our thanks to Dr. Tiffany Berry as this discussion continues right after this. The MyBSW Health app is available in your app store or go to MyBSWHealth.com. All right, everyone, continuing our conversation now about Baylor Scott and White Health and their new app, MyBSW Health app, and all of the advantages it holds for Texans. Even if you're not part of the Baylor Scott and White Health system, you can download the app for free, and so much information is accessible for free, including a community support group. We want to welcome in now Dr. Mike Mullender. He's the Chief Mission and Ministry Officer, a chaplain. Chaplain Mullender, thank you for joining us. We appreciate it.
Thanks, Ron. Great to be here.
Have you been with this community support forum? You've been involved with communicating with patients as they sort of begin to take a journey, many of them through some difficult health crises?
Yeah, it's been really amazing. It's one thing I appreciate. It's so easy to get to. So on the app right below where you might make an appointment, there's a community support tile, and folks can just click on that and begin to share needs emotionally or prayer requests, and our chaplains get to respond. It's really inspiring to see both what people share. It's all anonymous. There's no identifiers, but people share deeply about what's going on with them, and a chaplain's available to offer a prayer within the chat to follow up. And sometimes we connect people with other resources too. It's been quite it really opened my eyes to a whole new area of ministry and supporting people.
Do you think that even for people who aren't necessarily religious by conventional definitions, are still making connections? And does it speak to really how disconnected we are in some ways? I mean, I want to be able to say that person to person is best, but for many people who really do live in rural communities or are shut in for some other reason, is it providing a point of connection that they otherwise wouldn't have?
Yeah, that's right on line with what this does. There's all kinds of demographic studies that say people often consider themselves spiritual but not religious, or they're looking for other ways to connect and have meaning. And really, that's why we call this a community support wall. We want it to be a place that's open and welcoming to all people. We have a longtime founder many years ago said that we should be a place, our hospital should be the kind of place where people of all faiths and those of none could come with equal confidence. So we try to live that out today. And so when we began to create this, we really worked intentionally with our IT people to find out not what would a chaplain want to offer, but what do people want who might come to the app. Mm-hmm. And it's that kind of connection that you're talking about, Ron. It's I think we all became more aware of that during the pandemic. There's times we were more isolated or not able to get out and join with other community folks like we normally would. But I think even after that, people have realized, wow, there's other ways to connect and to support each other. Some of the support too is from chaplains providing prayers, but some of it is others indicating they're praying for the prayer requests on there, or some people expressing support for others or frontline workers. It's really inspiring to see how everyone comes together to support one another.
Is it fair to say that it's faith accessible but not faith based? In other words, if that's where you want to take it, it's there for you, but you don't necessarily have to be of faith to find the support that you need.
Yeah, that's a perfect way to say it. And in fact, it relates to part of the way we approach things. We ask patients from our inpatient facilities. We had a third-party vendor interview folks and say, what would great holistic care be to you? What would great spiritual care be to you? And we didn't use the word faith or talk about traditional religions. And what people said over and over again, 90% of the folks that responded said, if you treat me with dignity, compassion, and respect, I'll feel I've gotten great spiritual care, great health care. Mm-hmm. And we all know that healthcare is more than just getting a procedure or going through a series of tests, but it's how we become more whole and viewing healing as a holistic thing.
Well, and it's also knowing someone really cares, right? Especially after you've left the hospital environment. Recovery and having a connection and knowing people care for you, even if it's virtually, I would think makes a difference in the healing process. By the numbers, I want to break this down because more than 33,000 people engaged with this app in the first month. That's the first month. 1,000 messages were posted to the digital platform. And as it continues to grow, on average, you've got 18,000 users interacting per month. A couple of things strike me about that, and that is a safer place for people to have conversations around their health because they're all there for the same reason, so there's no judgment. And secondly, it's a safe space because they're getting guidance from medical professionals about their health condition. They're not going on some random Reddit forum or some other place where, frankly, it can become verbally abusive, right?
Yeah. As chaplains, we're passionate about reaching out to people who are seeking meaning, especially healthcare chaplains. How do we help folks find what makes things worthwhile as they're addressing illness or even wellness and living more fully? And so it's really a natural for the gifts and skills and the ways that chaplains are trained to respond to folks and include people of all different perspectives and to create a community that empowers everyone. So we've tried for years to do that in the hospital walls. And then, like you said, this is a great new opportunity to reach beyond a facility-based thing or to connect people and collaborate in the community. We do a lot of that with different community groups to connect folks in that way. So it's exciting for me to see some of these opportunities to connect to one another.
Well, and we hope that it makes for equal access to healthcare. We hope that it makes the healing process better when people who otherwise wouldn't have connection get it through this app. It's MyBSWHealth app. It's downloadable anywhere. It is free. And as we've talked about today, it provides a comprehensive approach to healthcare, even virtually from that first e-visit all the way through recovery and the community support. Pastor Chaplain Mullender, thank you for joining us. We appreciate it. Thank you for everything you do.
My pleasure. Thank you, Ron.
And thank you for joining us for Forward DFW together with the Dallas Morning News. I'm Ron Corning. We'll see you next time. Once again, the MyBSWHealth app is available in your app store or go to MyBSWHealth.com.